as a pelvic floor physical therapist, I improve quality of life. I worked with a man who actually stopped hugging his grandchildren because he thought he smelled like urine. And so he was able to significantly improve his incontinence and was back hugging his grandchildren. That's a big deal.
So there's a lot of reasons why people come to me for pelvic floor therapy. It could be because they're going to the bathroom frequently. It could be because they're having a hard time emptying. It could be because they're having pain with emptying. There's a lot of different reasons. It could be because they've had pain that's just not responding to like more traditional types of physical therapy. But really, as physical therapists, we can help a lot with quality of life. So even though we're treating the pelvic floor, it's kind of the same principles that go into treating like a knee with like a knee replacement. We really just help to make the day-to-day activities a little bit easier and maybe help with energy conservation.
With folks who have been diagnosed and are being treated for prostate cancer, I sometimes will see folks before they even undergo surgery, so that when they have surgery and they are in the process of recovering, they are already familiar with the exercises they need to do, the behavior modification techniques that they have to do. So I will also see folks after their surgery who are actively having particularly the urinary incontinence issues, and I'm able to help guide them towards their recovery to help them regain bladder control.
1 in 8 men will actually be diagnosed with prostate cancer. So the way to determine which treatment is the best for the patient is to really evaluate not only the cancer characteristics and the prostate characteristics, but also the patient's desired outcome and the risks and complications that they feel most comfortable with. All our treatments will cause some quality of life change. And unfortunately, I'm looking forward to the day where that is not the case. And one of the appointments that I make for everyone beforehand is pelvic floor physical therapy. The therapists are instrumental, and I can't say enough good words about them, in getting the patient to accept that this is a temporary issue, that it definitely has a solution, and there's someone on their side to help them along that way.
I think that a lot of times physical therapy, pelvic floor therapy is not looked at as like a primary standard care, and I think Riverside does a really good job of understanding why that might need to be challenged, because in the process of going through these treatments, you're still living your life day to day. You're still dealing with these symptoms day to day, and even though we're hoping that that goes into remission, in the meantime, you still want to have good quality of life and be able to do the things that make you you in the meantime. And I think that that is where we really have a solid place in being able to advocate for our patients to make life enjoyable in the meantime while you're going through treatment. That's why we do this, so that you can live your life.